Hello, friends. Happy Thursday. I'm going live now with BIRTHFIT Killeen to discuss pelvic therapy and her pelvic therapy story. So, hello, yay! All right, I'm going to turn off commenting so that the comments aren't on our faces, and I am sending you the... So you should have gotten it, and just click on the little button and we'll get connected. Hey, that's perfect.
Good.
Hi, Jennifer.
Hi.
Let's see your shirt.
You can't see it?
Well, there. Yes, I saw it.
Okay, let me.
There. Okay.
Okay.
Good. All right. BIRTHFIT.
Yes.
I love it. Thank you so much for joining today and being willing to share your experience, because this is huge. This is going to, potentially impact so many people that you've never met, and it's a personal thing. So this is the first type of interview that I've done of this sort as well, and I'm just really amazed that you're willing to share. So I want to say a profound thank you.
Thank you for having me. It's an honor, and I'm a little nervous because, like you said, it's a personal story, but knowing the potential of how many people it can help just makes me feel like it's worth it.
Thank you. Thank you so much. So before we get into the questions, would you just share a little bit about yourself and tell us about BIRTHFIT Killeen as well? Give yourself a shout out.
Okay. Well, my name is Jennifer Ballou. I currently live in Killeen, Texas, because my husband is an active duty soldier and he's stationed on Fort Hood, which is here in Killeen. We have 3 children. The youngest is 8 months old. Her name is Sophia. Then I have a son, Eddie, who's 11, and a daughter, Alexis, who's 22. So kind of like the joke, but it's really reality, is I have a baby every decade. And I'm retired from the Army. I served in the Army myself for 21 years. I retired in 2015. I am a certified professional life coach. I help professional women who juggle too much find wholeness and joy. Good. Which is amazing work. And then I'm also a BIRTHFIT leader. I own BIRTHFIT Killeen, and BIRTHFIT Killeen supports, educates, and empowers women throughout their entire motherhood transition. Optimally, I would meet a woman before she even becomes pregnant, and then work with her throughout her pregnancy and postpartum journey in the areas of fitness, nutrition, mindset, and connection. And the work that BIRTHFIT does is super empowering and amazing, and I'm just proud to be a part of it.
Well, they're lucky to have you on their team as well. So
thank you.
Great experience. And so let's just jump right into it. Tell me a little bit about what pelvic health related symptoms you were having prior to attending pelvic therapy.
Sure. So for years before I got pregnant with Sophia, my baby, I was experiencing primarily urine leakage when I would exercise. Mainly when I would do jumping types of exercises, like jump rope or jumping on top of things. But also times like when I would sneeze, or if I would be coughing, I would experience urine leakage. And, I really just sort of felt like that's normal. And that was the way that it was supposed to be after having children, because I really never experienced those things before I had kids. So those were the primary things that I was dealing with.
Did you notice it after baby number 1, baby number 2, or both?
Yeah, okay. Both. I noticed that after baby number 2, it was worse. But it definitely started after baby number 1.
Okay. That's a very common pattern.
Mhm.
Some interesting research that came out a couple years ago is that 76% of women that have leakage at 3 months postpartum will still have it 12 years later. So the concept of the myth really that, oh, it'll just get better on its own, it really doesn't get better. And so, on its own. So you're a living example of that, really.
Yes,
Mm-hmm.
absolutely.
Okay, so then how did you hear about pelvic therapy?
Yeah. So again, before I got pregnant with Sophia, I was in a gym environment, and it would kind of be the joke of all the women, like before we would do certain movements, like I need to run to the restroom, or like we're jumping rope today, did you wear a pad, or whatever the case may be. And I just remember a newer lady who came to the gym said, yeah, you guys, like it's normal, it's common, but
Yeah.
it's not necessarily normal. I had a baby not too long ago, and I saw a pelvic floor physical therapist, and she has been working with me on this exact thing, and I'm going, what in the world is
a physical therapist?
Yeah, I had never heard of it before, and again, was uneducated. And just kind of thought, well, I had my last child so many years ago. Certainly this wouldn't be something for me.
Mm-hmm.
So that was the first time
Mm-hmm.
that I heard about it.
Yeah.
But I didn't pursue seeing them at that time.
Mm-hmm. But that gives you a sense of how, like, the lack of awareness of this intervention, basically.
Yes.
Mm-hmm.
Yes.
And also, you're another example of, like, well, could this help me? Am I really the target population? But listen to this. So I've worked with, as long as you want to get better and you have the mental capability, we will work with you. I've worked all the way from 3 years old, which was primarily parental intervention, but we worked, generally it's going to be age 5 and above. And then my oldest patient has been 94.
Wow.
So yes, across the lifespan, we still have pelvic floor muscles that still have jobs to do. And as long as you have the cognitive functioning, we can help you.
Yes.
So good. All right. So then at what point did you decide to make an appointment?
Right. So I got pregnant, and after I had Sophia, let me back up. When I was pregnant, I thought, I wonder if I should try to get seen now while I'm pregnant. And I asked my provider about it and was told to wait until after I gave birth, which I have since learned is not.
Yeah, you don't have to wait. You don't have to wait. Now, the research is, so if you are not continent before getting pregnant, so let's say you're having leakage already before getting pregnant and then the leakage worsens,
Mm-hmm.
the research isn't super strong to say that that's going to improve during pregnancy. But if you are dry going into pregnancy, the research is good to say, yes, we can provide pelvic floor muscle training during pregnancy.
Yes.
And it's not that we can't work with you even if you had some leakage before, because there's some other things other than pelvic floor muscle training in terms of support and positions and breathing and pressure management. There's so much that can be done. So and more research is needed. We need more research in all of this, but so that's good.
So I decided, okay, fine, I'll wait. And during that same time, I was getting so educated by the BIRTHFIT world. I'm surrounded by so many smart and educated people in this, community who I'm learning from. Yeah. And so I thought, I don't even want to wait until I, recover postpartum and see how my leakage is months down the line. So at my 6-week postpartum checkup, I was curious to see if the provider would ask me anything about it, and she did not, which is another sort of like red flag for me, because if a woman you don't know what you don't know.
No. And if you think it's normal, my mom had a weak bladder. Oh, I had a baby. This is normal. You're not going to come out with that. And the same thing with some other pelvic health conditions like pain with sex. You don't know that that it may not be normal. So I think as a provider, any providers out there, ask direct questions.
Yes.
Are you having urinary leakage? Are you having pelvic heaviness? Do you feel a vaginal bulge? Are you having pain with sex? Are you having fecal leakage or difficulty controlling your gas?
Yes, yes. So I took a course, a woman's health dynamic neuromuscular stabilization course when I was pregnant, and that really opened my eyes to just so much. And so again, my provider at my 6-week postpartum checkup didn't mention it, but lucky for me, I knew I was educated. I was informed. And so I said, hey, I was wondering if you could refer me to a pelvic floor physical therapist. And she was just like, yeah, sure, I'll put it in. Didn't ask any questions or anything. So, yeah.
So that's good. I mean, and that's good that your provider knew what it was and that she knew where to, or he or she knew where to refer you. So
she did.
Excellent. Yeah. Good. Okay, so then was it difficult to get an appointment? What did that process entail?
No, it wasn't difficult at all. She said she was going to put in the referral, and I think within a couple days I was called by the office that was going to be providing my care.
Good. Okay, great. So now your first visit, you're entering your first visit. So what are you feeling? What are you thinking? And then tell us a little bit, as much as you want to share about the first visit.
Yeah, sure. So I was nervous for a lot of different reasons. First of all, my baby was only a couple months old and I wasn't really ready to leave her with anyone. So I decided to bring her with me. So I wasn't really sure how that whole situation was going to go. But I got there and the provider that I saw was amazing in every way, made me feel very comfortable, asked me why I was there and what my symptoms were, asked me a ton of questions, and then did an internal exam. And just, I think it's one thing to like hear what I have to say and what's going on with me, but to actually probably feel it for herself, was just clarifying or verifying whatever was going on. And then based on all of that, she put together a plan of how often we were going to see each other going forward. Yeah.
Good. So then if you can summarize your therapy experience. So, what kinds of things were you doing? So let's start there. So tell me a little bit about some of the interventions that you did during therapy, and then also what did your home program look like?
Sure. Yeah. So there was in-person therapy, and then she would always give me homework to do when I wasn't there to just continue the work. And so based on what I was dealing with, we identified that I needed to work on strengthening the muscles. And so when I was in the office, we started with very gentle, there was like a device that I had to put into my vagina, and it was like it would provide biofeedback. So we could see the strength of my pelvic floor when I would contract and release on the screen, which was super cool.
Isn't that cool? So it's kind of like a tampon that inserts into the vaginal canal.
Exactly.
And if any of you have ever had an EKG or seen an EKG on TV, it's very similar to that. So it's reading the electrical activity of your muscles. Like the EKG reads the electrical activity of your heart, and you see this is reading the electrical activity of your muscles. But so tell us a little bit, like when you would squeeze, what would happen?
Yeah, so when I would squeeze, you would see on the screen the little indicator line go, up. And then depending on if she was having me hold it, it would stay up. And at the beginning, it wouldn't stay up for very long. She'd like say, hold it for as long as you can. And I mean, it was like a workout. Like, oh my
you
God.
think it's so simple, just this little Kegel muscle. No.
Yeah. But so based on how much I was contracting and for how long, you could see it you know, stay up or go back down. And so she would, all of my exercises initially, I was laying down on the table and we would kind of see. And then well, I don't want to get too far ahead of myself. So, you know, she would say, hold, release, then hold, different types of things. And then she would give me some homework. So I would do, you know, 3 or 4 times a day. She would have me doing like quick types of contractions and then as well as like endurance type of contractions. And then when I would come back, she would sort of reassess to see if things were improving, and assuming they were, which for me they were. I took my homework very seriously, by the way.
Good.
I remember her telling me that no one ever really does their homework, and she was just like, I was the best patient.
Oh, that's good. That's good.
So then we would graduate to seated types of exercises, and eventually standing, jumping.
Functional things. Like, so recreating some of the activities that you were experiencing leakage with, but in therapy with the biofeedback, so you could see the engagement of your muscles.
Right. So I mentioned one of the times I would experience leakage would be like if I would cough or sneeze. So she would tell me to like anticipate that I'm about to cough, engage my pelvic floor, and then cough. And then we could see on the monitor what happened.
Did it spike or not? Good. Great. Okay. And so then about how many visits and about how long of a time span?
Yeah. So I was being seen every week for about 2 months. And then she made it to every other week.
Kind of taper down.
For I think another month. And that was it. I think I was seen about 3 months.
Okay, good. And so we talked a little bit about what your visits were like. Is there anything else you want to share that you think people might be curious about what happened during pelvic floor therapy?
Yeah.
So were you out in the middle of a gym? Were you in a private room? Were there other people with you?
Right. That's a great question. No, I was in a private like treatment room. It was just me, and sometimes I brought my baby, sometimes I didn't. And the doctor. It was very private.
Okay. And then did you get to keep your clothes on, or did you have to take your clothes off every time?
Great question. Yes. No, I kept my clothes on. So what she would do is the little device, like tampon like that we talked about, I kind of kept that and would bring it with me to every appointment. And she would, you know, we would chat at the beginning of the appointment, and then she would leave the room. I would insert the device and then put my underwear and pants back on. And I would be fully clothed during my sessions.
Did you feel anything from the device? Like did it sting you, or did you feel anything coming out from it with the biofeedback?
Right. Great question. No, I did not feel anything there. It wasn't painful. It wasn't uncomfortable. I would say it just took a little bit of getting used to just like having that there and doing the different, you know, exercises, but I didn't feel anything.
Good. Okay.
Yeah.
So then how did it turn out? So did you have successful resolution of your symptoms?
I am so happy to share that I have not had any symptoms. I have not, I mean, I'm very active and I have not had any leakage during workouts, during jump roping, during coughing or sneezing.
Awesome. And are you doing everything that you want to do?
Yes. Yes. Doing everything that I want to do. And, you know, when we decided that I graduated, you know, she kind of said, if the symptoms come back or if I have any questions, that I could always revisit again. But I haven't had the need to do so.
Good. So some of the things that you could do, that you can do now without leakage that you couldn't do before, well, you could do them, you just had leakage with them. So jumping,
coughing, sneezing, sometimes squatting.
Okay.
Those are primarily
Yeah.
the movements.
Yeah. Those high impact or those high pressure times.
Yes. Even
That,
running sometimes. Running as well. Yep.
yep. Okay. And then what does your home program look like now?
That's a great question.
I didn't include that in my pre-questions.
I know. I mean,
You don't,
if I'm being perfectly
Yeah.
honest, it's pretty much non-existent.
But you're incorporating your pelvic floor into your regular activities.
This is very true. I am. And BirthFit has some wonderful movements. We call them functional progressions that help rehabilitate and strengthen your core and pelvic floor. And I continue to do those on my postpartum journey, which
Good.
I guess it's not fair to say I'm not doing anything, but I'm not doing like the
isolated.
Correct.
Like isolate. Yeah. And I think that's okay. You know, it really is progress is very individual, but if the goal is that our pelvic floor is automatically engaged in what we're doing, right? So good, your pelvic floor is engaged. And then if you're doing some intentional recruitment in addition to some of the things that you're doing, or while you're doing some of the functional progression things, that's ideal.
Yeah.
So we don't want to completely ignore the pelvic floor and not think about it again.
No.
All right. So what would you tell someone that's considering pelvic therapy, but they're not sure?
If I got a chance, I would tell someone who's considering pelvic therapy to maybe talk to somebody who they know has had it, to get their personal experience. But if they do not know anybody, just give it a try. I mean, you have nothing to lose and everything to gain. It's very freeing to not have to worry about having those problems or those issues again. So as uncomfortable as it may be to walk into your doctor's office and say, I've been having X symptoms for years, there is help out there. There are people that are trained to get you where you want to go.
Right. Help you live your best life.
Help you live your best life.
Yes.
And so I am a complete advocate of go for it.
Don't live with leakage. Don't live with pelvic pain. Don't live with pelvic heaviness or pressure. There's things that can be done. Even if you've tried Kegels before and they didn't work, try pelvic therapy. It's way more than Kegels.
So much more than Kegels. Yeah.
Yes. And then is there anything you wish you could have done differently?
Well, I wish I would have
known about it.
I wish I would have, when I first learned about pelvic therapy, I wish I would have leaned in and asked more questions then, instead of for years still dealing with my leakage. Because I would have learned that you don't have to have just had a baby to go through this therapy.
Yeah.
So I wish I wouldn't have waited.
And anyone out there that's listening, there's a lot of free resources available. Our website, mypfm.com, has some resources. And then on our YouTube channel, My Pelvic Floor Muscles, and Instagram. And then if you want to direct message me or email me, I answer all my messages personally. So I'm happy to connect with you. And Jennifer, if somebody has a question, would you be willing to engage with them?
Absolutely.
So direct message us.
Yes, direct message me. And I'm so passionate about it that I have become a My PFM ambassador.
Yes!
Which I'm super excited about, because I know what it feels like to live with these symptoms and, be a little bit embarrassed about it.
Yeah.
And I just want everybody to know that they don't have to live that way.
No. And it's okay to say these words. It's okay to talk about it. And there's nothing that you did wrong.
Correct.
So, it's a very exciting time. So BirthFit Killeen is Jennifer's address. I'm My Pelvic Floor Muscles. I'm Jeanice. Is there anything else you would like to share with the audience before we go?
No, just, reach out if you have any questions. Jeanice does answer all of her messages personally. So if you're not really ready to take the step of making an appointment with your provider, reach out to one of us. We'd be more than happy to talk to you.
Absolutely. And for those of you that may be wondering how to pay for it, health insurance covers it. So it's considered physical therapy, or there's also occupational therapists that specializes in this too. So if you have health insurance and you have a physical therapy benefit, this should be covered under it. And then there's, of course, self-pay options as well. So, all right, guys. Well, thank you so much, Jennifer, for sharing that. That was amazing. Thank you guys for joining us. We will be recording this and putting this on our YouTube channel, My Pelvic Floor Muscles, probably next week. And have a great day. Thanks again, Jennifer.
Bye.
Take care.
Jeanice.
Bye-bye.